Namaste. Our brain regularly sends tiny electrical impulses in an orderly pattern throughout the body. However, when there is a temporary change in this electrical functioning of the brain, it results in seizures. When a person experiences repeated seizures, it is known as epilepsy. It is very common in young children today and as well as in older adults. It can be easily managed with medical interventions and lifestyle changes accordingly. As a caregiver or an individual with epilepsy, it is very vital for you to understand the management of epilepsy. And we have with us our very eminent expert, Dr. S. Muthukani, consultant neurologist and epileptologist at Apollo Hospitals, Greams Road, Chennai. He will shed more light on this topic today and help us understand all we need to know about the management of epilepsy. Welcome to our FB Live, Doctor.
Vanakkam.
What is epilepsy, Doctor?
See, epilepsy is a very common neurological problem, and epilepsy is actually basically defined as when you get a seizure which is recurrent. That means if you get more than 2 episodes of seizures in the gap of 24 hours, we call that person is having epilepsy, which is a very common neurological problem, especially in developing countries like India. If you look at the statistics, almost more than 10 million people in India are actually suffering from epilepsy. It is one of the very common and pertinent neurological problems we face in day-to-day neurological practice.
So, what are the causes, doctor, of epilepsy, and who is at risk of getting more than 2 seizures, as you mentioned?
See, the causes of epilepsy is basically depending upon the age group of the patient. If you take children, in fact, children are actually suffering from epilepsy more than older adults. So, it is commonly a disease of childhood period. If you look at the childhood period or child who is having epilepsy, the reasons or the causes are actually a bit different than the older adults. Generally in children, the most common reason for having epilepsy in India is perinatal insult. That means when the child is born, there may be a problem with oxygen supply or glucose supply to the brain, which can produce serious and permanent neurological problems in the brain, which will present as epilepsy. That is the most common reason in children in India. Other than that, the common causes of epilepsy are some malformations of cortical development in the brain, or there may be some brain infection which can present with epilepsy. These are the common reasons for epilepsy in childhood period. If you take older adults, the common reasons are a bit different. They can have a stroke which can present as seizures or epilepsy in the later part of the period, or they can have an accident which can produce damage to the brain which will present again as epilepsy, or they can have tumors in the brain which will again present with seizures or epilepsy. So these are the common reasons in older adults period.
So, what are the signs or symptoms, doctor?
The signs and symptoms of epilepsy are, so we'll talk about seizure. There are actually several types of seizures. For better clarification, we will stick on to the main types. We can easily divide them into 2 types. One is called a focal seizure, other one is called a generalized seizure. In focal seizure, the seizure is actually starting from a particular part of the brain, and those seizures usually present with, they can have an impaired awareness. They may not be able to communicate with the surroundings. They can have some oral chewing automatisms. They can chew, or they can have some manual movements like this. They can do some fumbling movements also, and they will not be aware of any of these things, and there will be a complete amnesia for these episodes. They may not be aware that they had this seizure. This is what generally a focal seizure present with. Sometimes they can have rapid jerky movements also, but that is bit rare. That is what called as focal seizure. If you take a generalized seizure, that is what we commonly see in movies. The person will have a jerky movements in the hands, legs. There may be some uprolling of eyes. There may be tongue bite, and they can have bladder or bowel incontinence also during the seizure. That is what called as a generalized seizure. They both are completely different, and the management also different for focal epilepsy and generalized epilepsy.
So, how is epilepsy managed, doctor?
If you look at the management of epilepsy, we can divide them into 3 steps. The first step would be we would start the patient on a particular anti-seizure medication or anti-epileptic medication. Currently, we do have several options. We will choose according to the patient type of epilepsy, what they have, and their age group, and their comorbidities. They may be having hypertension, diabetes, or some other comorbidities they may have, or they may be obese, or they may be having some psychiatric or psychological problems. So depending upon what they have, we will choose a particular anti-seizure medication. That is what the first step would be. The second step or the second option for the management of epilepsy is diet therapy, where we will give a particular diet called ketogenic diet, which will be very much useful in several select types of epilepsy patients. And again, that is very much useful in children who are presenting with epilepsy, where we use ketogenic diet commonly, because adults may not like the dietary options which is being included in the ketogenic diet. And the third step or the third option for management is epilepsy surgery. It will come into play when the patient is not responding to the medications and or dietary therapy. Then you don't have anything else. We can offer several surgical options. I think we are going to discuss about that very shortly.
Is epilepsy genetic, doctor?
Epilepsy can be genetic, but it is not for everyone. So that is everyone's worry. If you have a person with epilepsy in your family, so you will be obviously worried that whether it will go on to the next generation of that patient. The chance of having epilepsy affecting the successive generation is actually in fact very less. It is actually most of the epilepsy is actually polygenic. That means it is because of involvement of multiple genetic mutations and other things. So it is not that simple to say like whether it will go on to the second generation or third generation, something like that. But there is a selected group of epilepsy where it is because of a single particular mutation, and the chance of having passing on to the second or third generation is significant in those group of patients. But overall, if you take, it will be around 2-3%.
And a very commonly asked question, is there a cure for epilepsy?
Generally, like when we talk about epilepsy management, we don't talk about cure, we talk about seizure control, because with the management with anti-seizure medications or the dietary therapy, it will not provide cure for epilepsy. It will only control the seizures. It may not alter the underlying problem because of which the patient is actually having seizures. So it may not produce cure, but it will definitely control the disease. But if the patient is not responding to these medications and diet, what we are going to talk about this epilepsy surgery shortly, that may provide cure in select group of patients with refractory epilepsy.
Doctor, you mentioned about anti-seizure medications. When are these medications given, doctor?
I already told you that the first step would be whenever a patient who is coming with a seizure, the first step would be we will give a particular anti-seizure medication. So we will choose that anti-seizure medication depending upon the patient's age and the type of seizure and other comorbids. That would be our first line of management. Only when they fail a particular anti-seizure medication, then we may change the anti-seizure medication, or we may add one another anti-seizure medication to the treatment plan, and depending upon the patient's response, we will decide about the next step of management.
So, and how long will these patients need to take anti-seizure medications, doctor? Or is it just depending on the condition of the patient?
Again, the duration of epilepsy management is depending upon the generally the epilepsy type, what they have. For example, a child who is having an age dependent epilepsy, generally they will outgrow the epilepsy when they cross a particular age group. Generally when they cross around 12 to 14 years of age, or when they attain puberty, generally they will outgrow epilepsy. So those group of patients, they may not require lifelong treatment. But again, suppose if a patient who is having a generalized genetic epilepsy, where we know that the risk will be lifelong. So in those patients, the longer duration of anti-seizure medication is generally required. maybe they may require lifelong treatment with particular medications also. So it varies from what the seizure type they have, what is the epilepsy type they have, depending upon whether it is genetic or something else. So lots of factors will come into play to decide about the exact duration of anti-seizure medications. But in general, if you ask, maybe we generally give it for 2 years, and if the patient doesn't have any seizure after starting a particular anti-seizure medication for 2 years, then we would try to wean them off from the medication, then we'll try to stop it after 2 years.
Doctor, a lot has been said about diet therapy, and you also mentioned about keto diet being prescribed for patients with epilepsy. How does it help a person with epilepsy, doctor? Can you elaborate about it, please?
Definitely, Deepa. So we have several types of dietary therapy which is currently available. Um, Dietary therapy, we generally give it for children who is actually suffering from epilepsy, especially when they are not getting controlled with anti-seizure medications. Or suppose if a child is having a genetic type of epilepsy where the diet will be very much useful. For example, an epilepsy type called GLUT1 receptor deficiency syndrome, where the diet therapy, the ketogenic diet therapy, is actually the mainstay of treatment. If we look at the types of this ketogenic diet, we do have currently 4 types of ketogenic diet. The first one is called classical ketogenic diet, and the second one is called modified Atkins diet, and the third one is called low glycemic index diet, and the final type is medium chain triglyceride diet. So these are the 4 different dietary options which are currently available, which we can use it for children or even adults. If they can accept this dietary plans, we can definitely use. How does this dietary therapy actually work in epilepsy? We don't know the exact mechanism. How does it work? Probably the diet is actually nothing but you give a diet which is very high in fat, and you reduce the carbohydrates significantly, and you give the reasonable or the required amount of protein. So this combination is actually called as ketogenic diet. What it does, it actually produces ketone bodies in our system, which actually helps in reducing the excitability of the brain. So when the excitability of the brain is coming down, obviously your seizures will come in frequency. So that is how it generally works. Even though the exact sequence, how does it act and all, it's not very clear as of now. Main disclaimer about this ketogenic diet, it is not for all person who is actually suffering from epilepsy. You need to consult with your treating neurologist, and you need to involve a dietitian who is specialized in managing all these ketogenic diets. Then only it can be started upon.
Doctor, when is surgery an option, and who is the right candidate for it?
Before discussing about the surgery and the surgical options we have for epilepsy, first we should know about a drug resistant epilepsy or drug refractory epilepsy, because those are the main group of people where we are going to talk about this epilepsy surgery. Drug resistant epilepsy is nothing but when a person who is not responding to two properly chosen anti-epileptic medications. So a person came with seizure, you start the first drug, they are not responding, means the seizures are still coming. So you start the second medicine, even then the seizures are coming. That means they are not responding to the first 2 properly chosen medicines with adequate dosage and adequate duration. So when they are not responding to the 2 properly chosen medicine, then that means that they have become refractory or resistant to the drug management. Those group of patients, we call them as drug resistant or drug refractory epilepsy, and they are the main candidates for epilepsy surgery.
Like any surgery, doctor, what are the risks involved, and what are the risks of surgery for treating epilepsy?
That's a very pertinent question, Deepa. Thanks for asking that, because whenever you talk about some surgery, especially like some surgery which is going to, like we are going to do it in brain, so the people will obviously worry about the side effects. But if you look at the studies which have analyzed all the side effects of epilepsy surgery, the incidence of minor side effects following epilepsy surgery is less than 1%. And having a reasonable or a major side effect following epilepsy surgery is around 4 to 5%. This amount of side effect is quite comparable with any surgery which the patients are getting done on every day if you go to the hospital. So that means epilepsy surgery is nothing to fear about. It has minimal complications and maximum success rate, because if a person who is not getting controlled with the seizures, if you are going to do the epilepsy surgery, they will become completely seizure free in around 80% of the patients. So the success rate is around close to 80%. That is not at all possible with the medication, because with the medication the chance is around 5 to 10% to get a complete seizure freedom, especially if they are drug resistant or drug refractory. But if you talk about epilepsy surgery, the chance of success is around close to 80%. That is quite significantly better than the medical management. So that is why like we talk about this epilepsy surgery nowadays.
Doctor, we'll take some common questions from our viewers. Is stress one of the very common indicators for seizures or epilepsy attacks?
Stress, yes, it plays a role in triggering the seizure. If the patient with an epilepsy who is having significant stress, maybe because of this, it may not be a direct trigger. Because of the stress, the people may not sleep well, and they may have some problems in their office or at home. So all these things can directly or indirectly influence the seizure frequency. So it may be a seizure trigger. That is what we generally say, the patient should be stress free. They need to reduce their stress as much as possible.
Doctor, what happens when a person gets frequent seizures or epilepsy in a public place? And in such cases, how can the public, as such, at large, help these people?
So this is why I think everyone should know about the first aid for a seizure. For example, I think nowadays there are lots of teaching programs for cardiopulmonary resuscitation when a patient gets cardiac arrest. That is being taught in medical schools or even the normal schools, colleges also nowadays it is getting taught, because anyone can have a cardiac arrest and where you can act or you can do the CPR. Similar to that, in epilepsy management, everyone should be aware about the first aid for a seizure, because a child who can get a seizure in the school, or they can get a school in the when they are going to the schools or outside. So everyone should be aware that what we should do when a person gets a seizure. We can easily remember this first aid using three simple steps. The first is stay. You need to stay with the patient and time the event when it starts and inform the hospital emergency if it requires. That is the first steps. You need to stay with the patient. And the second step is save. You need to safeguard the patient. For example, if they are close to some sharp objects or something, you need to like keep them away from the patient. Suppose if they are wearing a like tight tie or a very tight belt, something like that, you can like relax them. That is what you need to do. That is the second step. That means safeguard the patient. And the third step is side. That means like you need to put the patient in right lateral or left lateral position. That means you need to turn the patient to one side. Don't put the patient in prone position like this, face down. No, don't do like that. You need to just turn the patient to the right side or left side, because when a person is actually having a seizure, there will be lots of secretions which will come up in the oral cavity. So there will be lots of pooling. And if you turn the patient to either side, the secretions will come out of the mouth, so that will not go into the lungs by aspirating. So that is why we generally encourage the caregivers or the caretakers to turn the patient to either side, either right side or left side. So these are the three steps you need to do, because more than 90% of the seizures, they will stop within a minute or two. So you don't need to do anything. You don't need to give any specific medication. Only if it's going on for more than 2 minutes or more than 5 minutes without regaining of consciousness, you need to really worry, and you need to shift the patient immediately to the nearby hospital. So this is what we should do during a seizure. Same way, we also should know what we should not do. For example, you might have seen that in movies and all, when a person gets seizure, someone will come and give a keychain, or they will give us some iron rod or something. You should not do that, because when a person is having actively seizing, it will come and injure the patient. So it is not recommended. You should not do that. That is one important thing. And the second worry that people get is, when the patient is having a major seizure, they will fear that they will get a tongue bite. So to avoid the tongue bite, what they do, they will put their hand inside the patient's mouth, or they will put a spoon, or they will put some cloth to avoid the tongue bite. Don't do that, because if you do all these things, it will block the patient's airway, and it will lead on to a serious consequences. So don't do all those things. These are the things which we should not do during a patient's seizure.
Hello, doctor. My father always has taken anti-seizure medications, but until now, it has not really helped him. Is surgery the next option for him?
Yes, definitely. If a person who is not getting controlled with the two properly chosen medicines, yes, definitely we can evaluate him for possible surgical options. Before embarking on to the surgical option, we need to do some investigations. The first step is long-term video EEG. For example, in Apollo Hospitals, Chennai, we do have long-term video EEG monitoring, where we would admit the patients and do EEG for 3 to 5 days continuously, and during that period we will reduce and stop the medicines, so the patient's chance of having seizures is on the higher side. So once they get the seizure, we will record the seizure in the video and along with EEG. So now you will come to know where the seizure is actually coming from in the part of the brain, whether it is coming from the right side or left side, anteriorly or posteriorly. So you will get an idea where it is coming from. And the second step would be, we will do a high quality MRI called 3 Tesla MRI by using a specific protocol called epilepsy protocol. So we'll use a very thin cuts MRI, and by analyzing that with the help of a neuroradiologist who is actually trained in epilepsy sequencing. So we will get the help. So we will analyze this EEG and MRI. So depending upon these first two things, then we will proceed about the surgical options.
My cousin, who was an epilepsy patient, passed away suddenly. The cause of her death was sudden unexplained death in epilepsy, or SUDEP as they call it. What is SUDEP and what causes it?
This is another thing that the public and the people with epilepsy, they should actually know. So something is called SUDEP, that means sudden unexpected death in epilepsy patients. So they will get a sudden death which is unexplainable and unexpected. Even if you do autopsy, you may not be able to know why this patient suddenly died, because of like what caused this problem. So that is what we call that as SUDEP. Who is at risk for this SUDEP? There are several risk factors for SUDEP. The first and foremost is uncontrolled seizure. So if a child or an adult who is having uncontrolled epilepsy, then the chance of having SUDEP is significantly higher. That is why we talk about controlling the seizure is utmost important. They should control the seizures completely. That is very important. That is the main risk factor. If they have an uncontrolled seizure, then the chance is higher. The second is, suppose if the child is having or the adult is having nocturnal seizures, nighttime seizures, then again the risk is on the higher side. And the third important risk factor is generalized seizure. If someone who is having very frequent generalized seizure, generalized tonic-clonic seizures, then again the chances is on the higher side. And if you don't take your medicines, if you don't sleep well, and if you are using some drugs of abuse, all these things can aggravate the chances of having SUDEP. You should avoid all these things. You should take your medications at a proper time, and you should sleep well for at least 7 to 8 hours during the night time. Try to avoid daytime sleep. Try to only sleep during the night time, and take the medicines properly and control your seizures altogether. Then only the chance of SUDEP will come down.
Speaking of controlling epilepsy, doctor, are there any other ways to manage the disease besides medication, diet, and surgery that we all discussed about? Is there any other way to manage epilepsy?
So the first and the main steps of treatment which we have already discussed. But if you take the surgical perspective of epilepsy management, we did talk about surgeries a little. I'll just briefly explain the two main surgical options which we have. The first option is called focal resection. where you go on and resect a part of the brain where the seizure is actually coming from. That is the most common surgery which we do for people with epilepsy. That is called focal resective surgery. And the second type of epilepsy surgery is called disconnection surgery, where you go and disconnect a part of the brain from other part of the same hemisphere, or you can disconnect both the hemispheres. So these are the common surgeries which we do for people with epilepsy. And with the advent and usage of very advanced neurosurgical monitoring techniques, now we are able to do all these epilepsy surgeries without any significant complication rate. And this is a main discussion about this epilepsy surgery. If you talk about, suppose some patients, they may say that I don't want to undergo any resective surgeries, then there are several options which are coming up now, where we call them as non-resective surgical options. The first option is called vagal nerve stimulation. What we do in that, we will place a small chip in the vagus nerve on the side of the neck, and that chip will attach to the vagus nerve, and that chip will be connected to a battery which will be placed in the just over the chest on the left side. So it will be basically connected through a wire which will be tunneled subcutaneously under the skin. It will be tunneled. With the help of battery, the vagus nerve is getting frequently stimulated with the help of electrical impulses. So by keeping on stimulating this vagus nerve, the seizure frequency actually will come down significantly. So that is what called as vagal nerve stimulation. And the second non-resective surgical option is called a deep brain stimulation. You might have known this, that deep brain stimulation is actually nowadays getting done for people with Parkinson's disease. The same methodology is also being used in people with drug refractory epilepsy. Same method, we will place the chip inside the brain, and it will be connected to a battery in the chest wall. The same method, by producing continuous impulses to a particular area of the brain, it will reduce the seizure frequency. These are the two main non-resective surgical options. There are other things called radio frequency ablation, where suppose if a very small area of the brain which is producing the seizure, and they don't want to undergo resective surgery, then what we do, we will place a small probe inside the brain in that area. So by placing that probe in that area, we will give a radio frequency ablation. So we will basically ablate that area, and it will produce significant seizure reduction. That is what called as radio frequency ablation. These are the common non-resective neurosurgical option is currently available in India. But if you look at the advanced developed countries like US, there are two other systems which have been developed in the recent times. The one is called responsive neurostimulation. Again, it's basically similar to this deep brain stimulation. They will place chips in one or two areas of the brain, and it will be again connected with the battery. By producing continuous electrical impulses, it will reduce the seizure frequency. That is responsive neurostimulation, but it will not be continuously giving the electrical impulses. When the seizure happens, this method will start providing electrical impulses, so it will go on impede with the seizure. So the seizure frequency or the seizure will not manifest. That is what called as responsive neurostimulation. That is one thing. The second system which has been developed in the recent time is LIT, called laser interstitial thermal therapy. Someone might ask, is there any possibility of using laser for the epilepsy management? Yes, we can definitely use. It has come up significantly in US. Currently they are using it. I hope very soon it will come to India also. Again, it is similar to this radio frequency ablation. It is basically, they will place a probe in a particular area of the brain, and by using the laser, very accurately we will be able to deliver a particular amount of current to that part of the brain to ablate that area. So that is what called as laser interstitial thermal therapy. These are the two systems which will come to India very soon, we are expecting.
Thank you so much, Doctor. What would be your message to our viewers today?
The simple thing regarding the epilepsy management would be, you first meet with a proper doctor who is having an adequate experience in managing seizure or epilepsy. And the second step would be, you take the medications properly. Don't skip the medicines. Suppose if you have forgotten to take the medicine whenever you come to know that you have missed the medicine. Don't skip the medications. So if you take the medications properly and if you follow the doctor's advice properly, like having a very good sleep schedule for 7 to 8 hours in the night, and not missing the medications, keeping yourself stress free, then definitely we can conquer this epilepsy. And even then, still if you are not able to control seizures or epilepsy with these managements, now we have the option of epilepsy surgery. No need to fear about this epilepsy surgery. We do have several options available. Again, you better have better understanding about this epilepsy surgery, and you discuss with your treating neurologist or epileptologist about the options. Then we can definitely proceed with the possible neurosurgical option.
Thank you very much, Doctor. That was a very enlightening session on all we needed to know and understand about how we can manage epilepsy. For appointments with Dr. S. Muthukani, consultant neurologist and epileptologist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, for appointments with Dr. Muthukani, consultant neurologist and epileptologist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. Thank you very much, Doctor.
Thank you.
Thank you, viewers.